1 in 9 men will have prostate cancer in their lifetime, but the good news is that most men diagnosed with prostate cancer will not die from it. Urologist Dr. Michael Consolo at Pomona Valley Hospital Medical Center reveals how genetic testing will be the future for screening men for prostate cancer.
Prostate cancer is a disease that refers to the uncontrolled replication of cells within the prostate gland. Over time, these cells will form a tumor or multiple tumors within the prostate, and if left unchecked, those cells will continue to divide and can even spread outside of the prostate and will metastasize to lymph nodes or other organs such as the bone.
Some men are more at risk of developing prostate cancer.
Age is very important as a risk factor. We're very much focused on men aged 55 to 69 years old. Those are the men that we screen most aggressively. And men younger than that are very unlikely to develop prostate cancer unless they have a strong family history or if there are genetic influences. African Americans are more likely to develop prostate cancer. Their prostate cancers tend to be more aggressive, and they're actually more likely to die from their prostate cancer.
Dr. Consolo outlines screening guidelines and who would need a biopsy.
Prostate cancer at this point can only be diagnosed in one way, and that's with a prostate biopsy. So prostate biopsy involves taking small tissue samples from the prostate and looking at that tissue under a microscope, looking for prostate cancer. The question is which patients need a biopsy. We screen men from age 55 to 69, and if their PSA is elevated, that's a blood test that we use to screen for prostate cancer. If that number is elevated, or if they have an abnormal digital rectal exam, then those men usually go on to receive a prostate biopsy to look for prostate cancer. Molecular testing or genetic testing is probably going to be the future of prostate cancer screening and will help us with the diagnosis, particularly with patients who have a borderline PSA or maybe have a rising PSA but multiple negative biopsies, and we think that there might be prostate cancer there, but we can't seem to find it. So some of these other tests can help us to determine what that patient's individual risk of having prostate cancer is.
The treatments for early-stage prostate cancer are very successful.
For clinically localized prostate cancer, the main treatment options include radical prostatectomy, which involves removal of the prostate gland and the seminal vesicles, or radiation therapy. Radiation can be delivered usually in one of two ways, either with radiation seeds or via an external beam. For lower risk prostate cancers, oftentimes we will advocate that those patients undergo something called active surveillance, which is actually delaying treatment and just monitoring their prostate cancer very closely. The benefit of that is that they don't need to deal with the side effects or surgical complications from their treatment. Treatment for prostate cancer that is clinically localized, meaning non-metastatic, is usually quite successful. Our goal with men with clinically localized prostate cancer is to cure them either with radiation or radical pelvic surgery, and those men tend to do quite well.
Dr. Consolo reveals the advances in prostate cancer care.
In the last 10 years, there's been significant progression and advancement in the treatments that we have specifically for patients with advanced prostate cancer. So there have been a number of agents that have come on the market which have a significant survival benefit in this population of patients who previously did not have many options.